discuss the general anatomy of the skin and the fascia. At the end of the lecture, the students should be able to discuss in detail the structure of the skin, discuss the superficial fascia, and discuss the deep fascia. So, what is the skin? It is the general covering of the entire external surface of the body, including the external auditory meatus and the outer surface of the tympanic membrane. Continuous with the mucous membrane at the orifices of the body, and because of the large number of functions, regarded as an important organ of the body. Now, the adult surface area of the skin is about 1.5 to 2 square meters. In order to assess the area involving the burn, one can follow the rule of 9, that is, the head and neck 9%, each upper limb 9%, the front and back together constitute 18%, the back including the buttock another 18%, each of the limb 18%, and perineum 1%. Now, the area is calculated by the Du Bois formula, in which area is equal to the weight of an individual in kilogram into height in centimeter with 17.184, right? In the child as well, you can see the right and the left leg is 13.5, 13.5, different from the adult, where it is 18, 18 of each of the limb. Coming to the pigmentation of the skin, the color of the skin is determined by 5 principal pigments that is present at different areas of the skin. We have the melanin pigment, which is brown in color, which is present in the germinative zone of the epidermis. The melanoid, resembling melanin, present diffusely throughout the epidermis. The carotene, yellow to orange pigment, present in stratum corneum, and the fat cells of dermis and the superficial fascia. Hemoglobin purple, whereas oxyhemoglobin is red in combination with oxygen, present in the cutaneous vessels. Now, the amounts of the first 3 pigments, that is your melanin, melanoid, and carotene, vary with the race and age of the body. In white races or the Caucasian race, the color of the skin chiefly depends on the vascularity of the dermis and thickness, that is translucency of the keratin. The color is red where keratin is thin, that is the lips, and it is white where keratin is thick, that is palms and soles. And the thickness of the skin varies about 0.5 to 3 mm. Right. So coming to the structure of the skin, it is composed of 2 distinct layers, the epidermis and the dermis. The epidermis is a superficial avascular layer of stratified squamous epithelium, ectodermal in origin, giving rise to the appendages of the skin, that is the hair, nail, sweat gland, and the sebaceous gland. Structurally, the epidermis is made up of a superficial cornified zone and a deep germinative zone. Here. So you can have a look at the layers of the epidermis. The cells of the deepest layer proliferate and pass towards the surface to replace the cornified layer due to wear and tear. As the cells migrate superficially, they become more and more flattened, lose their nuclei to form flattened dead cells of the stratum corneum. In the germinative zone, there are also DOPA positive melanocytes, that is the melanoblast, dendritic cells or clear cells that are of the neural crest origin, which are synthesizing melanin. Also, the epidermis here is made up of connective tissue with variable elastic fibers mixed with blood vessels, lymphatics, and nerves. The connective tissue is arranged in a superficial papillary layer and a deep reticular layer. The papillary layer forms conical blunt projection called the dermal papillae. This is the dermal papillae, the tongue-like projection which fit into the reciprocal depression onto the undersurface of the epidermis. Here they are more clear. The reticular layer is chiefly composed of white fibrous tissue arranged mostly in the parallel bundles. The direction of the bundles constituting flexure or the cleavage lines or Langerhans lines is longitudinal and in the limbs and horizontal in the trunk and the neck. Here, so you can see the dermal papillae over here. In old age, the elastic fibers undergo atrophy and the skin becomes wrinkled. Overstretching of the skin can lead to rupture of the fiber, followed by scar formation. These scars appear as white streaks on the skin called the linea gravidarum. At the flexure lines of the joints, the skin is firmly adherent to the underlying deep fascia. The dermis is basically the real skin because when it is dried, it makes the green hide, and when it tanned, it makes the leather. The deep surface of this dermis is continuous with the superficial fascia, as you can see over here. So the dermis, this is the continuation with the superficial fascia. Right, this is the thick skin of the palm, devoid of hair. You can see the stratum corneum over here. Next is the stratum lucidum. Then we have the stratum granulosum. When you can see the scales with granules that are basically the keratohyalin granules. Then we have the stratum spinosum, the stratum basale with the melanin pigment. You can see the brown pigment over here, resting on a basement membrane, and intervening are the tongue-like dermal papilla. Here, the dermal papilla, the same layers, along with the openings of the excretory duct of the sweat gland. Now coming to the surface irregularities of the skin, we have the tension lines that forms a network of linear furrows which divide the surface into polygonal or lozenge shaped areas, as you can see on the right. These lines to some extent correspond to variation in the pattern of fibers in the dermis. So coming to the flexure lines or skin creases or skin joints, there are certain permanent lines along which the skin folds into habitual movement. You can see the lines over here, these lines over here at the joints. Okay, these lines are prominent opposite the flexure of the joints, basically over here, and more prominent particularly on the palm, soles, and the digits. We also have something called the papillary ridge or the friction ridge, which is confined basically to the palms and sole and their digits. They are forming narrow ridges separated by fine parallel grooves arranged in curved arrays, and they are corresponding to pattern of the dermal papilla. Right. Their study is a branch of science called dermatoglyphics. The three major patterns in human fingerprinting include loops, whorls, and arches. These patterns and many other minor features are determined genetically or by multifactorial inheritance. Coming to the appendages of the skin, firstly we'll see the nail. They are basically hardened keratin plates, the cornified zone, on the dorsal surface of the tip of the fingers and toes, acting as a rigid support for the digital pad of terminal phalanx. Each nail has the following parts. Firstly, it has a root, nail root, which is the proximal hidden part buried into the nail groove and overlapped by the nail fold of the skin. Free edge is the distal free part of the skin. The body is the exposed part of the nail which is adherent to the underlying skin. The proximal part of the body presents a white opaque crescent called the lunule. Now each lateral border of the nail body is overlapped by a fold of skin termed the nail wall. The skin, that is the germinative zone plus the corium, beneath the root, this one, and the body of the nail is called the nail bed. This is the nail bed, you can see over here. The germinative zone of the nail bed beneath the root and the lunule is thick and proliferative, the germinal matrix, and is responsible for the growth of the nail. The rest of the nail bed is thin, over which the growing nail is going to glide. Under the translucent body, right, except the lunule, is the body, the corium is extremely vascular, and this accounts for the pink color. Right. So in anemia, the nails become absolutely pale and white, as you can see over here. Okay. In iron deficiency anemia, they also become thin, brittle, and spoon-shaped. Now, the spoon-shaped nails are called the koilonychia. Hypertrophy of the nail bed is called clubbing. You can see the thickened nails. It occurs in chronic suppurative diseases like the lung abscess, bronchiectasis, osteomyelitis, and in severe type of cyanosis caused by phallostetrology and chronic congestive cardiac failure. Disturbance of nail growth due to acute illness or trauma gives rise to transverse grooves in the nail substance which move distally with the nail growth. And the average rate of growth is about 0.1 mm per day or 3 mm per month. The date of the past illness can be estimated by it. Now, ichthyosis is characterized by abnormally dry skin. The sebaceous glands are few and small, and the secretions of the sebum is markedly reduced. As you can see, the skin is extremely dry. Excessive oiliness of skin due to hyperactivity of sebaceous gland is called seborrhea. It can occur from puberty onwards but diminishes with advancing age. Acne vulgaris is a common complication of seborrhea. Seborrheic skin is susceptible to infection, that is seborrheic dermatitis or furunculosis, and to chemical irritants like the chemical folliculitis and dermatitis. The next appendage is the hair, which are nothing but keratin filaments derived from invaginations of the germinative layer of the epidermis into the dermis. They are peculiar to mammals like feathers to the bird and help in conservation of their body heat. However, in man, the heat loss is prevented by cutaneous sensation of touch. Hair are distributed all over the body except for the palm soles, dorsal surface of distal phalanx, umbilicus, glans penis, inner surface of prepuce, the labia minora, and the inner surface of the labia majora. The length, thickness, and color of the hair vary in different part of the body and in different individuals. Each hair has an implanted part called the root and a projected part called the shaft. The root, furthermore, is surrounded by the hair follicle, right? Hair follicle, that is the sheath of epidermis and the dermis, and expanded at the proximal end to form the bulb, right? This is the bulb. This part is called the bulb. Each hair bulb is invaginated at its end by a hair papilla, that is the vascular connective tissue, which forms the neurovascular hilum of the hair and its sheath. Right? This is the papilla and this is the hair bulb. Now hair grows at the hair bulb, this is the hair bulb, by proliferation of its cells capping the papilla, the hair follicle enclosing the hair root, lies obliquely at the surface of the skin, which is responsible for its characteristic hair streams in different part of the body. The erector pylori muscle over here, and is the smooth muscle supplied by the sympathetic nerve, connect the undersurface of these follicles to the superficial part of the dermis, as you can see over here. Right. So contraction of these muscles will lead to erection of the hair, squeezing out of the sebum, producing the goose skin. The fetal skin is covered by fine hair called lanugo, that is the primary hair. They are mostly shed at birth and are replaced during infancy by another set of fine hair called the vellus or the secondary hair. Now, these are retained in most parts of the body but are replaced by the thick and dark terminal hair of the scalp and the eyebrow and hairy areas of the adult skin. The hair is growing at the rate of about 1.5 to 2.2 mm per week, and their growth is controlled by hormones. The lifespan of the hair varies from 4 months, that is of eyelashes and the axillary hair, to 4 years, that is your scalp hair. Now they exhibit alteration in certain diseases. In malnutrition, hair becomes extremely thin, dry, and sparse. In hypothyroidism, they become coarse and dry. Excessive growth of hair, that's hirsutism, occurs in adrenogenital syndrome. This is hirsutism. Loss of hair is called alopecia. Skin is dry in datura poisoning, heat stroke, and diabetic coma, and unusually moist in hypoglycemic coma and peripheral failure. So let's talk about the sweat glands now, right? Pseudoreferous or sweat glands are distributed all over the skin except for the lips, glans penis, and the nail bed. Now, these glands are of two parts, the eccrine and the apocrine. The eccrine parts are much more abundant and distributed in almost every part of the skin. Now, each gland has a single tube, the deep part of which is coiled into a ball. The coiled part, called the body of the gland, lies in the deeper part of the corium or in the subcutaneous tissue. The straight part, called the duct, traverses the entire dermis and the epidermis and opens onto the surface of the skin here. Okay, so you can see the excretory portion of the sweat gland, right? So we have the myoepithelial cells around the secretory portion that are helping out to squeeze the secretions. This is the secretory portion of the apocrine sweat glands along with the blood vessels, and we have the connective tissue of the dermis. Now, these glands are largely found in the axilla and the groin, most numerous in the palms and the soles, and least numerous in the neck and the back. The eccrine glands are merocrine in nature, that is, produce their thin watery secretions without any disintegration of the epithelial cells. They are supplied and controlled by cholinergic sympathetic nerves. The glands help in regulation of the body temperature by evaporation of sweat and also help in secreting the body salts. In dogs, the sweat glands are confined in the foot pads. Therefore, the dogs do not sweat, they pant. The apocrine glands are confined to the axilla, eyelids, here they are called the Moll's glands, nipple and areola of the breast, perianal region, and the external genitalia. They are larger than the eccrine glands and produce a thicker secretion having a characteristic odor, which they develop in close association with hair, and their ducts typically open into the distal end of the hair follicle over here. Ceruminous glands of the external auditory meatus are basically the modified apocrine sweat glands. Now, the apocrine glands are also mesocrine in nature but are regulated by the dual autonomic control. Some workers are not inclined to call them sweat glands at all because they are not responding sufficiently to temperature changes. In animals, they are producing chemical signals or pheromones, which are important in courtship and social behavior. On an average, 1 liter of sweat is secreted per day. Another 400 ml of water is lost through the lungs and 100 ml through the feces. This makes a total of about 1500 ml, a rough estimate of the invisible loss of water per day. However, in hot climates, the secretion of sweat may amount to 3 to 10 liters per day with a maximum of 1 to 2 liters per hour. So long the sweat glands are intact, the skin can regenerate. If the sweat glands are lost, skin grafting becomes necessary. Right. So another type of gland, that is the sebaceous gland, which are producing the oily secretion. The sweat was a watery secretion. They are widely distributed over the dermis of the body except for the palms and the soles, right? They are they are especially abundant in the scalp and the face and are also very numerous around the apertures of the ear, the nose, the mouth, and the anus. Sebaceous glands are small and sacculated in appearance, made up of a cluster of about 2 to 5 pyriform alveoli. Right. Can you see here? These are your ceruminous glands, sebaceous glands. Their ducts open into the hair follicle with the exception of the lip, glans penis, inner surface of the prepuce, labia minora, nipple, and the areola of the breast, along with the tarsal glands of the eyelids, and the ducts open on the surface of the skin. Sebaceous glands are holocrine in nature, that is, they produce secretion by complete fatty degeneration of the central cells of the alveolus, which are then replaced by proliferating peripheral cells. Now, this secretion is under hormonal control, especially the androgen. The oily secretion of the sebaceous gland is called the sebum. Now, this sebum is helpful in lubricating skin and protects it from moisture, desiccation, and harmful sun rays. Sebum also lubricates hair and prevents them from becoming brittle. In addition, sebum also has some bactericidal action, making the skin proof. Water evaporates from the skin, but the fats and oils are absorbed by it. Functions of the skin: it offers protection from mechanical injuries, infection, heat and cold, wet and rot, acid alkali, and the rays of the sun. Sensory: to touch, pain, temperature, regulates body temperature, absorption, secretion of sweat and sebum, excretion of water and salt, regulation of pH, and synthesis of vitamin D. Right. Now come to the superficial fascia. Next layer. This was the skin. Right. We have the superficial fascia over here. Right. General coating of the body, that is beneath the skin, made up of loose areolar tissue with varying amount of fat. Now, distribution of fat in this fascia: abundant in the gluteal region, that is the buttocks, lumbar region, that is the flanks, front of the thigh, anterior abdominal wall below the umbilicus, the mammary gland, post deltoid region, and the cervicothoracic region. In the female, more abundant and more evenly distributed than males, fat is absent from eyelid, external ear, penis, and the scrotum. The subcutaneous layer of the fat is called panniculus adiposus. In females, this fat in the superficial area of the lower abdomen, upper thigh, where in males it is inside the abdominal cavity. In general, the women fat forms a thicker and more even layer than in the men. Okay, So, like we had panniculosus adiposus, we have panniculosus carnosus, right? Which are these muscles? That is the craniofacial muscles, the platysma, the palmaris brevis. Now, fat, that is the adipose tissue, fills up the hollow spaces like the axilla, orbits, and the ischiorectal fossa. Fat is present around the kidneys in the abdomen, supporting the organs. Now, there are two types of fats, the yellow and the brown fat. Most of the body fat is yellow. Only in hibernating animals it is brown. The cells of the brown fat are smaller, with several small droplets and multiple mitochondria. Fat cells are specialized cells, and the size of the fat cells increases during accumulation of fat rather than the number of cells. Okay. Now, this is how a fat cell typically looks like. The nucleus is pushed to the periphery with a large lipid droplet. Now, any attempt in reducing the excessive fat must be slow and steady and not drastic to avoid harm to the body. Important features: the superficial fascia is most distinct in the lower part of the anterior abdominal wall, in the perineum, and in the limbs. It is very thin on dorsal aspect of hands and feet, sides of the neck, face, and around the anus. Also dense in the scalp, palms, and soles. Now, superficial fascia shows stratification or layering in the lower part of the anterior abdominal wall, the perineum, and uppermost part of the thighs. It contains subcutaneous muscles in the face, neck, and the scrotum. B. Mammary gland, deeply situated sweat glands, localized group of lymph nodes, cutaneous nerves and vessels. Now, the superficial fascia is helping in facilitating movements of the skin, serves as a soft medium for the passage of vessels and nerves to the skin, and helpful in conserving the body heat. Now, let's see the deep fascia. It is a fibrous sheet which is investing the body beneath the superficial fascia, devoid of fat and usually inelastic and tough. Now, distribution. The deep fascia is best defined in the limbs where it is forming a tough and a tight sleeve, and in the neck where it is forming a collar. Okay, ill defined on the trunk and the face. This is the deep fascia of the leg. Can you see it's a very thick structure? Now, prolongation of the deep fascias are basically forming the intermuscular septum, which is dividing the limb into compartments, the fibroadular sheath of the muscles, vessels, and nerves. The thickening of the deep fascia is forming retinacular or the retention bands around certain joints like the wrist and the ankle. Here. Also forming the palmar aponeurosis and the plantar aponeurosis in the foot for the protection of the nerves and vessels. Interruption in the deep fascia on the subcutaneous bone. Now, deep fascia never crosses the subcutaneous bone. Instead, it blends with the periosteum and is bound down to the bone. Modifications of deep fascia. It is forming the intermuscular septa, separating functionally different group of muscles into separate compartments. Also covers each muscle as epimysium, which sends the septa to enclose each muscle fasciculus known as the perimysium. From the perimysium, this is the perimysium over here, fibers septa pass to enclose each muscle fiber, and they are called the endomysium. This is your endomysium over here. Now, through all these connective tissue septa, that is the endomysium, the epimysium, the perimysium, arterioles, capillaries, venules, lymphatics, nerves traverse to reach each muscle fiber. Like the muscle, the deep fascia also covers each nerve as the epineurium, you can see, as perineurium and individual nerve fibers as the endoneurium. These connective tissue coverings support the nerve fibers and carry the capillaries and the lymphatics. Also forms sheath around large arteries like the axillary sheath and the carotid sheath. The deep fascia is dense around the artery and rather loose around the vein to give an allowance for the vein to distend. It is also modified to form the capsule, synovial membrane, and bursa in relation to the joints, forms tendon sheaths wherever tendon crosses over a joint. This mechanism prevents wear and tear of the tendon. In the region of the palm and the sole, modified to form the epineuroses, this is the palmar and the plantar epineuroses, which afford protection to the underlying structures. Forming septa between various muscles, especially well developed in the calf muscle of the lower limb. Contraction of these calf muscles in the tight sleeve of deep fascia helps in pushing the venous blood and lymph towards the heart. Thus, the deep fascia helps in venous and lymphatic return from the